So if you are a student who is just now graduating and you're trying to figure out what specialty to go into or what unit to work on for your first job, these are 5 things to consider. Hi, welcome back to my channel. My name is Shanika. If you are new here, welcome. It's been so long since I've filmed a video, and I'm really trying to produce more nursing content because I feel like that's been doing so well on my page. I know I'm gonna get questions about my hair. I've done a video before on this hair. Find it somewhere below on my page. Back to the video. It's 5 things to consider before working in the NICU. So if you are a student who is just now graduating and you're trying to figure out what specialty to go into or what unit to work on for your first job, these are 5 things to consider. Or even if you're trying to switch specialties, these are going to be 5 important things to consider before you apply to those jobs, while you're still looking and hunting for those jobs and you're doing interviews. These are important things to consider. There are different levels to the NICU. You can have level 1, level 2, level 3 NICUs, and even in the States I think they even go up to level 4. There are 4 NICU levels ranging from 1 to 4, 4 being the most severe. So level 1 is the most common. It's basically newborns that require very minimal supervision. Here it says require minimal observation treatment for common newborn issues such as jaundice and difficulty eating, most babies needing level 1 care. That's like a regular nursery. Do not have any complex health issues. So the next one is level 2. They could be born like greater than 28 weeks, and at that point they may have more serious medical issues but still don't require major interventions. They don't require surgery, they don't require breathing support or very minimal breathing support. Babies who start in a level 2 often progress well with appropriate monitoring until they get to go home and they're after being stabilized. So that's level 2. Now level 3, I work in a level 3 NICU. This is a level that requires more complicated treatments such as minor surgical procedures, mechanical ventilation to keep them stable until they're able to breathe on their own again. So level 3s really specialize in supporting babies respiratory wise. A lot of different ventilation respiratory support methods for these babies because they essentially cannot breathe on their own. They need that extra support. With a level 3, they may take longer to recover compared to those with the lower level because of their medical condition. Level 4, it says here that it's a level where they require surgical intervention. Is that, like, for example, if they perforate or they need like heart surgery, something like that, then you would be looking at like a step up, level 4. So that's what I got from the definition here on Google, is that if you are a student, like really this video is focused on students because I was in that position not too long ago. I've only been working as a nurse for 2 years, almost 2 years, not even 2 years yet. And I didn't know what these levels were. So really think about what do you want to do. With a level 2, again, you're going to be working with babies that are more so feeder growers. They won't really require so much respiratory support, but again, they're just working on feeding, they're working on growing. They might have issues like jaundice, but it's a lot less respiratory concerns. Level 3, you'll have a lot of different like respiratory supports, and so you as a nurse will get to know the different ventilation methods, the ventilation machines, and the different methods to support the babies on. And so I find when you work in a level 3, it's a lot of critical thinking. It's a lot of learning. There's a lot of new things. It's a lot of learning, and there's a lot of critical thinking. And because you're not just feeding a baby and putting them back to sleep, you're actually assisting doctors with procedures. What else? You're working closely with your RT, and it can be really busy because, again, when we think about the level of acuity, it's higher. These babies are much more ill, so it's gonna require a lot more demand. Okay, the next thing I want you guys to consider is, can you manage working 12-hour shifts? Because 12-hour shifts in the hospital on like nurse is totally different. Like, you know, some people have started, like I've seen so many people have started and they realize that, you know, maybe working 12-hour night shifts is not for me. Maybe they want to do something else, like a clinic work. Just know that when you're working in the NICU, you're not just holding babies all day, giggling, laughing. It's great. It's a beautiful thing, and it can be fun, but these kids can be really seriously ill. And if it's a 12-hour shift, you could be on your feet for 12, like, you know, like 13, 12 hours. 11, 12 hours. It can feel like it's a lot of go, go, go. So it's just something to consider. The next thing to consider is your training. Okay, so this is a whole thing on its own. So your training. So for me, I'm gonna speak from my experience. From my experience, I consolidated on a pediatric unit. My preceptor at the time, while I was in school doing my consolidation, she was cross-trained for NICU and peds. I got to experience working in the NICU. I also got the chance to experience working in the pediatric unit. I realized I liked the NICU better. So that's how I got my intro to it. That was great because I felt like it got me my foot in the door. I was able to see a little bit about what a level 2 looks like and if I would like working with that patient population. So that's I would highly recommend that if you are a student, you're still in nursing school and you're soon gonna graduate and you're trying to figure out what unit to consolidate on. Try to see if you can consolidate on a NICU unit, because that will be a great way to get your foot in the door. It is not necessary, but it is a great way. So the other thing to consider is when you get hired, is your unit going to train you? Yes, they should train you. All units should give you a rundown, should give you a training, but to what extent are they gonna train you? I was fortunate enough, my unit that I work on, they trained me for 3 months. So I had a 3-month orientation. I had somebody that stuck by me for 3 months, showed me the ropes, taught me a lot. I learned a lot. And even when I was off orientation, I was never really alone, and I had that support. I got in-class training and I got like hands-on experience training. This was all through my unit, my employer, right? So these stood out to me as to why I chose the job that I chose, because I knew I would have that extra support. I would not be just thrown in there and have to like learn on the fly. I would have somebody with me for at least 3 months. So that was great, because sometimes like you barely hear about people getting offered 3-month, like an extensive orientation. So that's something to consider when you're looking for jobs, okay? The other thing to consider is extra education. So this is education that you can purchase, or you can like source yourself, purchase yourself. And one of them is maybe your community college might offer a course that is tailored to the NICU, like a specialty, right? Just like there is like ICU and med-surg courses, you can take a NICU course that specializes in neonatal intensive cares and teach you. So let me just, again, I'm located in Ontario, so my references are going to be specific to my location, but so one of the courses that are available for nurses to take, this is a registered nurse program, meaning you have to be a graduated registered nurse. It's called the Perinatal Intensive Care Nursing Program. This is offered through like George Brown, and this program, it says it is a postgraduate program that prepares registered nurses to care for critically ill newborns for their families in an intensive care setting. So this course, I believe it's 1 semester, so 4 months, and essentially, if you are like, let's say you're in a different specialty, let's say you work in emerge and you want to get out of emerge, and you want to do NICU, but you want to change your specialty, but you know nothing about NICU, this is a good way to, you know, kind of educate yourself. I actually didn't do this course because I'm already working in my field, but it is a good way to get the theory, to get the background knowledge, and so that you can feel competent when you are working. And it's just an option when it comes to advancing your education in this specialty. Okay, the next course that will also kind of set you apart and help you to advance your education when it comes to this specialty is the stable program. Like, it's STABLE program, neonatal education. So I haven't done this either, but I've seen some people talk about the stable course, and I heard it's really good at talking about premature babies and how to care for them. It's a self-study course, but essentially it helps you understand your assessment skills and gives you some background knowledge so that when you do work in this field, you do work in this specialty, you can feel more competent and confident in your skills. So again, these are ways that you as a nurse can take it upon yourself, educate yourself, and kind of set yourself apart. Because if you had this stable course on your resume, or you had the George Brown course on your resume, that will make you stand out when you apply to jobs in this field. It's not necessary, because I got into my job without having any of this, but it could help, and it might make you feel more confident. So consider if you can handle taking care of really sick babies and their family, especially when they don't make it, you know, if they pass away. Because the truth is, although we save many babies, we save way more babies than the ones that don't make it. And it's always an amazing feeling when you know you've helped a family, you've helped the child, and they're able to recover and move on with their life, and they're happy and healthy. But it doesn't always happen, but it can happen, and it does happen that some don't make it. And when you experience that, or when a kid turns around and it gets really, really ill, it can affect you, and it can be really, you know, disheartening, and it can be sad. So it's just something to consider. Like, can you manage that? Can you handle that? Just like, you know, working with adults. If you work in emergency, I'm sure some people don't make it. I'm sure people pass away. It's just part of nursing care, and it's just something to consider. For me, like I said, I know that I take care of more babies, and I help more babies than the ones that don't make it. Like, you know, I actually have never, in my almost 2 years, I've never had my own, knock on wood, I've never had my own instance where one of my patients did not make it. But it does happen, and it can happen, so you just have to be aware. Okay. Anyways, I didn't want to make this video too long. Thank you guys so much for watching. If you have any questions about working in a NICU, please comment below. Let me know. Give me video ideas. Like, I need more content ideas, and I can come in and deliver that for you guys. Okay, I'll see you in the next one. Bye.